protect against this challenge. Steve, did you have a follow-up?
I do, thank you. I wanted to see from the governor's perspective if this changes your calculus at all on vaccination mandates, especially when we see, you mentioned the other day, such a stark disparity in terms of the problem spots upstate versus in New York City. Would you at all be looking at emulating what Mayor de Blasio has done in terms of mandate for employees or something like the key to NYC to go to restaurants or theaters or things like that? Does this at all change your calculus on vaccination mandates?
It also comes down to compliance, and I'm aware of the tools we have at our disposal. We have had even pushback with respect to our initial vaccine mandate, which was to have all healthcare workers receive a vaccine. I'm pleased that we have now 100% of healthcare workers who are working in nursing homes and in hospitals vaccinated, but that resulted in a loss of literally thousands of workers that we needed, which is why we have a situation now, one of the reasons we have a situation now to backfill those. So I know all the tools we have at our disposal. If we learn more about this variant, that it's different than we don't have enough information right now, but those are issues that I can trigger instantly. I can change the dynamic with the directive instantly, depending on the circumstances. So again, I don't want to overreact to this. The city of New York is different in that the density and how people work and how they travel together. The sidewalks are crowded, the subways are crowded, the public housing in particular, and all the apartments are crowded, dense places, and there's much more opportunity for transmissibility than we see elsewhere. That is a factor to take into consideration. The New York State workforce has a vaccinate or test to return to work situation now, and it's working very well. Our numbers of testing positive rates are very low. So I've put this on the table of issues that we have able to address, go further, but I don't know enough about this variant. We're not going to overreact, but I can react that quickly if we need to.
Thank you.